Hello and welcome back to leukemia. I wanted to take you over to your chart in your chapter, and it's 40-5 chart. I wanted to show you, there we go. I wanted to show you some of the key features for acute leukemia. Here they are. Your integumentary signs and symptoms, just like we had signs and symptoms of the other anemia before. I want you to look at the gastrointestinal signs and symptoms, renal signs and symptoms, musculoskeletal, and also cardiovascular along with respiratory signs and symptoms. And I believe we have just a little bit more. I just wanted to make sure I didn't leave out anything down there. There we go. And neurological signs and symptoms, which is fatigue, headache, and fever. Know the different signs and symptoms. These patients are experiencing a great deal of fatigue, and leukemia is affecting their body as a whole. Make sure we try to give them options. They still want to be involved with their family life and everything that's going on. Make sure we make them aware of sick days that they have for their job. They can have a sick day, so they can try to include other things in their life. So make that be an option for them, or not make it be, inform them of the option. Please read on the autoimmune thrombocytopenic purpura. Also know the autoimmune thrombocytopenic purpura is also called idiopathic thrombocytopenic purpura, ITP. So I want you guys to be familiar with ITP and look at the area that I have highlighted. Read first before you get to this area so you can understand why I highlighted that area, as well as down here below. So a rare complication is intracranial bleeding induced stroke. And so we definitely have to, we have patients with this condition, we definitely have to do a neuro assessment on these patients. So some patients who have surgery, and when they come back from surgery, we all know that prior to surgery, we get a consent. So before surgery. So we know that when they come back from surgery, they will have some dressings. Any surgery, you might have some type of drainage on the dressing. So that's expected. So just know that with any type of surgery, especially patients who are anemic, they're still going to have some drainage on their dressing, okay? But if the dressing is saturated, like, oh my gosh, this is a lot of drainage, that's definitely not expected, and we should notify the doctor, okay? Because patients who have this condition, the ITP condition, they are already at a high risk for bleeding. So if they're having a saturation, we definitely need to notify the doctor so we can make another plan of action of care for this patient. Okay, so the nurse, when you're providing care for that patient, make sure you assess the vital signs for shock and notify the surgeon immediately. Okay, assess the vital signs, notify the surgeon immediately. Okay, so those are things that are very important, and we need to make sure that we do our assessment and we do notification. And when we notify that surgeon, make sure, although the wound may be saturated, remember the first dressing from any surgery, the physician takes off first. So we definitely wouldn't remove it, but we'll apply more pressure if we saw that the patient was bleeding. Here you will learn more about blood transfusions and message 2, but just to introduce you to it, this chart is very informative, very informative. Packed red blood cells, this is the volume, this is how long it takes for it to be infused into the patient's body, and these are the indications why the patient needs that blood transfusion. Okay, watch red blood cells, this is how many it comes in a bag of 200 ml. This is how long it takes, 2 to 4 hours, and this is the indication for it, and so forth. So you also have more down here in your white blood cells. Okay, I want you to read that. And of course, with anything that we do, We have to make sure that we follow best practice for patient safety and quality. So for transfusion therapy, here are the nursing actions and the reasons why they are doing those actions. So I'm going to just scroll up very slowly. And remember, you can always pause if I'm going too fast. But these are the nursing actions and the rationales for it. Okay. So it's very good to have. It's in your book. I forget which table I was on. I'm already scrolling up, but I'm going to scroll back down so you guys can see what table, so you can go to your book and maybe make one of those cards out of that, because it's something you will need throughout your nursing career. What I have next is the platelet transfusion. You can read over that, but I wanted to make sure that I express to you that platelet counts, know your norms, know what the platelet count, if a platelet count is low, the patient is at a high risk for spontaneous bleeding. Repeat, if a platelet count is low, the patient is at a high risk for spontaneous bleeding. The most disastrous complication would be intracranial bleeding. So when your patients who platelets is low and they start just all of a sudden it was alert and oriented and now they're starting to be confused, you need to make sure that you notify your doctor right away, notify the rapid response team, because more than likely this patient has an intracranial bleed. Okay, so basically in a nutshell, any sudden neurological change and the patient does have a low platelet count, consider that emergent and get that rapid response team there with that patient as soon as possible. This is a patient that you will stay with. This is not a patient that you will tell the CNA or someone to do vitals or anything. This is someone that you need to stay with. You need to provide that care for. Patient-centered care, this patient is considered critical. So once again, make sure you know your platelet count. I know I went over blood transfusion with you, but I didn't reinforce wearing gloves. So I know we talk about safety, 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 and we have to make sure that we wear gloves. Just like in CPR, what's the first thing you do? You got to turn on the monitor. You got to turn on that on button in order to hear the prompts, right? For the defibrillator to work. For blood transfusions, before you do anything, you want to protect yourself. You want to put on gloves. Although you won't hang blood in MedSearch 1, but you should know about the different type of transfusions reactions, so you can know what to do and why it's important for us to stay with that patient the first 15 minutes. So I want to make sure that you're aware of the febrile transfusion reactions, very important. Need to make sure that you're aware of the hemolytic transfusion reaction. That is also important. Okay? All the reactions are important. But I want to make sure that you gear in towards that, okay? And then also it says here the reactions may be mild with fever and chills. Let's go all the way back and read hemolytic transfusions are caused by blood type or RH incompatibility. RH incompatibility. I can't talk anymore. I think I need something to drink. But make sure you understand that. Make sure you go back to febrile transfusion reactions that occur most often in patients with anti-WBC antibodies. So read this little area. Understand what febrile transfusion reaction. The patient is having a reaction to the blood transfusion. Hemolytic transfusion reactions. They are having a reaction. Okay, so read this section and understand why it's important. Here are more transfusions reactions. I know I had to do the teaching with this in the hospital, allergic transfusion reaction. Definitely know that. We also had to learn and teach the staff about bacterial transfusion reactions, which is important. And then also trolley. It's called trolley and taco. These are very important that we should know. Nurses didn't know about these, and it's right here in our med-surg book about trolley and taco. So look at the how we talked about the heart. So look at transfusion associated circulatory overload, taco, and transfusion related acute lung injury, trolley. So just think about the L in trolley, how it's talking about the lung, and think about the C and the O for circulatory overload for taco. That's what we called it to help us remember. Read this area and this, and it's good information to always keep with you, okay? And know your get ready for NCLEX examination key points. Safe and effective care environment. I'm going to scroll through these very quickly, but just know that this is information that you should know. This is how all the tests are set up: health promotion maintenance, psychosocial integrity, physiological integrity. So know this, and you can always pause, okay? I want everyone to make sure you look at your lab results. I did pull this from your syllabus over here. You do have your lab results that you need to look at, and they are your erythrocytes. Make sure you know the normal lab values, your leukocytes, platelets. We talked about that. We talked about hemoglobin in previous lectures. Look at your patient's scan. I showed you some pictures of some scans that are really paler, and that some that has circulation, and we looked at the conjunctivitis. Capillary refill time, we should know it should be less than 3 seconds, and also monitor your patient for distress, shortness of breath. So I'm going to leave you with this information. A patient has a platelet count, and you see what the number is. Now, things that we should do as nurses, I want to make sure that you always keep that in mind. What's wrong with that number first? So you need to know your normal. Then you're providing care for this patient. So you want to make sure that the patient has oral hygiene, they have that soft bristle toothbrush, or even the swabs they use on the mouth. You want to make sure you avoid any rectal trauma. So you probably don't want to do any enemas right there. No food that's going to irritate that gum or cause an accidental cut. So the food should be soft. No shaving with electric razor. So these are simple things, but believe it or not, they happen. So just wanted to reinforce that. Make sure you use maybe a lift sheet to reposition a patient. You don't want, that shearing or possible tear in the skin. As we come to an end, I want to talk a little bit about blood. Make sure you know the components, the 4 major components of blood. You have your plasma, your red blood cells, which is your erythrocytes, your white blood cells, which is your leukocytes, and of course your platelets. So we've talked about those, but make sure you understand that they are the 4 major components of blood. So plasma is the fluid that surrounds the blood cells and helps transport carbon dioxide, hormones, and metabolic waste products. Okay, so you have your red cells are formed in the bone marrow and functions mainly as oxygen carriers. So your white blood cells make up the body immune system by producing antibodies and helping destroy harmful microorganisms, and these cells are also created in the bone marrow. Okay, so that's very important for you to know, as well as your platelets. Your platelets are cells that clump together to help form blood clots and helps to protect the body from preventing bleeding. That's why it's so important to know those your normal, so you know when you walk into a patient's room, what are you getting into? A patient that's at risk for bleeding, at risk for clotting, red cells or white cells are high, risk are too low, risk for infection, different things. So this is all part of your critical thinking. So did you ever figure that out? So this patient whose platelet count is above, this patient has thrombocytopenia, and they require bleeding precautions. Thank you for listening, and keep reading. And don't forget to read your chapter on anemia and focus your chapter on the objective. So there's a lot of information in the book, but I want you to focus your reading on the objectives. Thank you, and see you in lecture.